Hello, this is Sean Huang with Safina Psychiatry. Today we will talk about the assessment of symptoms of bipolar disorder. Let's get started. There are two types of bipolar disorder, 1 and 2. Bipolar 1 disorder is marked by manic episodes, while bipolar 2 disorder is marked by hypomanic episodes. Bipolar disorder is associated with a 10-year reduction in life expectancy, which are mostly due to cardiovascular disease. There is also an increased risk for suicide. Of note, patients with bipolar 2 disorder are at an increased risk for suicide than those with bipolar 1 disorder. Lastly, bipolar disorder is associated with disability. Unipolar depression, or major depressive disorder as known in the DSM, is marked by recurrent depressive episodes, which can last from weeks to months. The provider could ask the patient, have you ever had a time when you were very sad, your body felt heavy, you could not get things done, and maybe you thought it was okay to not be alive? If so, tell me the very first time you've had that, and how many times have you had that over your entire life? Unipolar depression can be treated with exercise, mindfulness practices, monoamine agonist, therapy, as well as other modalities. Bipolar disorder is marked by either hypomanic or manic episodes. Very often, patients may experience mixed episodes in which both manic and depressive symptoms occur at the same time. This is a very uncomfortable feeling. One thing to keep in mind is that patients will spend most of their time in a depressed state or mixed state rather than in the manic state. Here is a simple question that can be asked to screen for bipolar disorder. It is easy to miss a bipolar 2 diagnosis because the hypomanic symptoms are not as pronounced as the manic symptoms. And so we are trying to capture hypomania with this question. To go further, there is also the CIDI, a validated tool for diagnosing bipolar disorder. It must be administered by someone and it cannot be taken by the patient alone. The main utility of the CD is to detect bipolar 2 disorder. If the patient scores positive on 2 of the 3 questions, you would ask the 9 questions that follow. And based on the number of questions scored positively, you would be provided a probability for bipolar disorder. Here are some other diagnoses to consider when diagnosing bipolar disorder. In borderline personality disorder, the changes in mood are constant and not episodic. The hallmark of post-traumatic stress disorder is that there needs to be a traumatic event in one's life that leads to many different symptoms. In schizophrenia, the hallmark symptom is psychosis, including visual and auditory hallucinations and delusions. There are many potential medical causes of manic symptoms. Common medications like monoamine agonists or antidepressants, corticosteroids, and amphetamines can cause mania. Thank you for watching. If you found this video to be informative, please like, share, and subscribe, and I'll see you in the next one.